Hello guys, welcome again to this session. I hope you're having a wonderful time, and I appreciate the entire team that usually subscribe to my channel. Now today we are going to proceed with the evidence-based practice scenarios, whereby you are provided with a scenario and an article summary. You are supposed to make a summary of the findings from this research. Now, I'll read the summary, the scenario and the article summary, then together we can make short notes out of that. Now, here I have a patient by the name Tara Smith, who is attending the wound care clinic at her local GP practice to have her venous ulcer dressed. A friend has told her about the use of honey dressings. Please provide her with the latest evidence on the same. Now, the article summary, which is now the research, is recent randomized studies indicate that there is no firm link that medical grade honey ensure that patients with chronic leg wound have an increased healing rate and improved outcome. A large study A conducted found out that there is no reduction in ulcer size or healing rate when using honey in comparison with standard treatments. The same study found out that the patients reported an increase in their pain levels. In study B, it was suggested that the honey provided an antimicrobial properties and had some benefits for those patients with MRSA. However, this was a study with a small sample, and therefore there is need for further research. The rationale for the use of honey in terms of cost effectiveness is also not supported in the research. Future recommendation would be that further robust research need to be taken into account to examine the efficacy of the use of honey to treat chronic venous ulcers in order that evidence-based protocols can be developed, in order for evidence-based protocols to be developed in hospital or the trust. That's now the article summary that you've been provided with, and you are supposed to make notes out of it and provide the patient with the latest evidence concerning the use of this honey. Now, what I developed from that article summary and what you can write on that paper that you will provided with in Osce can come in this format. So I'll state that research studies shows that there exists no direct link between use of medical grade honey to increase healing for chronic venous leg ulcers and better outcomes. One large study found out that there is no reduction in the size of the ulcer or the healing rate by use of honey as compared to the standard treatments that are already existing. Participants in the same study reported that they had increased pain levels. Another study reported that honey had antimicrobial properties and was useful for patients with chronic venous leg ulcers and have methicillin resistant Staphylococcus aureus infection, the MRSA. With this study having small sample, there is need for further research to confirm the same. In relation to cost effectiveness, there exists no evidence to support the same in using honey to treat the chronic venous leg ulcers. With the above considerations, there is need for intense research to determine the efficacy of honey in managing these chronic venous leg ulcers. Until then, the dressing of wound ought to be based on the current evidence-based practice and the protocols that exist in hospital, because with that one we are done with what we are supposed to provide the patient with. Directly related to what we've been doing, it's just a matter of paraphrasing and ensuring you capture the main points that are provided in the article summary. The article summary might be long, but ensure you cover all these that I've stated, because they align with what is expected of every candidate. And should you have these at any given point, then you've really passed that station. Thank you so much, and bye for now. See you then, and continue subscribing to my channel and following my videos. Thank you so much.